Welcome back. We'll now open the Summit Extensivist Clinic. Its goal is to provide lower cost acute treatment outside of the often very costly hospitals and emergency rooms. Here to talk with us about it this afternoon is Dr. Brian Hughes. Doctor, thank you very much for being here today.
Thank you, Austin.
So where is this hospital located here, or this Extensivist clinic?
Well, we're inside of one of the Summit Express clinics and one in Powell.
And how would something like this either be the same as or different than, say, an urgent care or a primary care physician?
Well, we're different than the urgent care. We're an extension of the primary care provider. Lots of times in the past, 100 years ago, 50 years ago, primary care providers were able to provide IV medications in their offices and other types of care. We can do that. In our clinic, we have the ability to put IVs in, to check labs. A lot of patients that we treat are patients that have failed oral treatments, such as antibiotics for pneumonia or skin infections or urinary tract infections.
And how would this differ than, say, your traditional hospital environment?
Well, we're not trying to substitute for a hospital. We're trying to create an environment where patients that are appropriate and have gone under selection. I always talk to the providers before they send somebody over to make sure they're appropriate and then see if we can manage them in a outpatient setting.
And is there a particular patient or a particular set of ailments that one would be, I guess, passed along to your clinic?
Well, one thing are these multi-drug resistant urinary tract infections people have been getting. They're resistant to all oral antibiotics. So in the past, people had to go to the emergency room and get admitted to the hospital, and then outpatient antibiotics had to be set up through the IV or in the hospital through the IV. We can do that in the outpatient setting because we have the ability to give them the IV medications and they avoid a stay in the hospital.
And as far as the all-important measure of cost, how does this differ from, say, a trip to the emergency room or to the hospital as well?
Well, the cost to the patient is just an office visit plus whatever ancillary things we do, put IVs in and so on.
And if somebody were wanting to find more information about this clinic as far as hours or any other care that's provided, where would they need to go for that?
Well, we're currently expanding this clinic within the Summit Medical Group, and so those physicians right now have the information to make that referral. Also, anybody can go to one of the Summit Express clinics and be evaluated, and those providers can refer to us as well.
All right. Dr. Hughes, thank you very much
for
coming in today.
Appreciate it.
Appreciate having you in here. And remember, if you missed anything during